Hello. Everybody's talking about the hip flexor, how it's connected to back pain and pain in the hip, and they're correct. And today, I'm going to show you an exercise that's perfect for slipping into your busy schedule and give your flexors some first-rate stretching. And as homework, I'll show you one point to press on to relax that muscle even more. Ina is already here, ready to demonstrate the exercise while I do the explaining. Please, Ina, turn to the side so we can demonstrate the exercise using your right leg. So you take your left foot one step back and go into a stance broad enough to still be able to keep your balance. You can do the exercise between two errands you have to run, even in situations where there's not enough floor space. You could do this one standing up. Take your left hand and place it on the upper ridge of your pelvis and put your right hand on the lower end of your buttocks. Why? Because you want to tilt your upper body back while taking your pelvis with you. And you'll feel rather quickly a pull right here in the front. And that's exactly what's starting the stretch. Breathe your way into this, deep breaths, and exhale. And on your exhale, you flex your stomach even more to take your pelvis with you when you bend backwards. Now you can feel the stretch getting stronger here. We're doing this exercise in real time, so take this stance and move around until you could feel this stretch. Going along this area here, that's your typical hip flexor stretch. Bend backwards and breathe. Nice and easy. Deep breaths in and out. Increase your effort. Visualize where this muscle sits. On the inside of your leg, one part of it runs up to your iliac bone to the inside, and the other part goes around the back towards your lumbar spine. Deep breaths in and out, and steadily increase the effort. Can you feel the stretch? Good. Now, you could try to keep your knee completely locked so that you can leave your leg like this and only hinge backwards above the hip joint. This puts the hip flexor right into the focus of this stretching exercise. So let's go and put one on top of this. Now you go to the right a bit. Tilt your upper body slightly to the right because that brings you farther away from the point where the flexor is attached. And that again increases the stretch even more. Stay under 10 on your personal pain scale. Work your way into the stretch. Theoretically, should you have balancing problems, you could lean on a windowsill, a chair, or a desk to keep yourself steady. And always go more and more into the stretch. You could also stay like this, Ina. Lean with your back on a desk so that your leg disappears under it. And the desktop could help you to stabilize your buttocks. And you wouldn't have to do the exercise freestanding. This would always be an option should it otherwise become too difficult for you. And now, let's exaggerate a bit. Well, not exaggerate exactly, that's the wrong word here, because remember, always stay under 10 on your personal pain scale. But go and bend your back and your head backwards even more and more again, and you'll notice how the stretch becomes stronger. Increase your effort a bit, and then slowly come back up again, and then move into the opposite direction and bend forward slightly. Does that feel good? It feels good to drop your upper body forward like this. Round your back. Rest for a moment. You at home, do the same. Swing left and right. Don't worry if you can't get down as low as Ina. Come back up again. And now we have to do the same on the other side. And that's why we're going to turn Ina a bit so that you could see her left leg. Now step back with your left foot. That's your right foot. Take the left one. All right, just a little joke. Your feet are apart, shoulder width, your right foot out a bit more, and again, your right hand goes in front of your pelvis, and your left hand at the lower part of your buttocks. so that you take your pelvis with you when you bend backwards. Go into the stretch. Great. Remember to lock your knee. And here is the hinge point. Slide a bit more south with your hand, Ina, and tense your abdominal muscles so that you pull your pubic bone upwards to bend your hips back more. Great. Are you in the stretch? Now start breathing into the exercise. Deep breaths in and out. And you at home, remember, if this should be too difficult for you because it really requires some balancing work, make use of a table or a desk and slide it under your buttocks so that you could bend over the tabletop or desktop. That should make things easier, recruiting a desk or table as a steadying device. Breathe in and out. Always tense up your stomach. Real nice. To better take your pelvis with you when you bend backwards. The more that is the case, and your knee doesn't move out in the front, the more you can get into this hip flexor stretch. Breathe nice and easy in and out. Great. Always increase your effort and tense up your abdominal muscles so that it takes your pelvis with you. Always work on that. Deep breaths in and out. And now, move your upper body a bit to the left. And you'll immediately notice how the stretch becomes more intense because you add this curve here, which pulls the hip flexor even longer. Breathe in and out, nice and easy. It's a good stabilizing exercise. It strengthens your body. You could do this exercise between 2 appointments. There's no mat required. Just do it. Deep breaths in and out. And work your way into the stretch more and more. Breathing in means you stay always under 10 on your personal pain scale, but more than 8. And always try to increase the stretch here in the front. Deep breaths in and out. More effort on your exhale and move to the left. And then slowly come back. It's a tough one, this exercise, right? You at home probably feel the same. Slowly move into the opposite direction. Drop your upper body down and try to round your back here. Then let yourself hang. Swing back and forth a bit. That's a good thing for loosening everything up. Side to side a bit and slowly get up. Great. And now I'm going to show you the osteopressure point for your hip flexor. Now, you take the base piece with the round attachment, the round tip, or a cork that you have to whittle a bit to round its top to better access the point. And now I'm going to explain to you how to find the spot. Put your left hand on your knee, and then at crotch level and on the inside, use your right finger to check for any tension that comes when your knee goes inward. Yeah? Flex and relax, and you'll notice how the adductors tense up, and exactly at that point, that's where these adductors end. You place your tool or cork on the inside and at an angle. Gently press on that point. Feel how very sensitive it is. Press in there, but always under 10, more than 8. And now you're exactly at the point where you build a pressure column acting on the bone. And that, via your brain, dials down the sensitivity of your left hip flexor. Stay on it. Press vertically from above. It's a bit more complicated to do this with a cork, but maybe you have something else you could use instead, something with a soft point if possible. And now let's swap sides. Again, look for the right spot. Just let me hold the tool. Put your hand on your knee and flex the adductors to identify the muscle gap, the point where there is no tension when you move your knee inwards. And as soon as you found the spot, take the tool and place it on that point at the angle like you could see here. You could use your other hand for support. And then you do what we just did on the other side. And here, the same rule applies to pressing points as it does to stretching exercises. You breathe in, you breathe out, and you keep looking. And relax when you breathe out. Information on the Osteopressure toolset can be found up there on the info card, and you'll receive detailed information on how to use the tools. Very easy. Slowly leave this position and ask yourself how you feel now after having pressed these points. I'm sure your hip feels much different now after the exercise. That was a very intense stretching exercise for your hip flexors. Ina can testify to that. If you want easier exercises for a different way to stretch your hip flexors, exercises that are shorter and use other positions, then click here on our playlist. And in case you haven't subscribed to our channel yet, you could do that here. Other than that, we'd be happy about a thumbs up and see you soon.